Fecal incontinence, most patients describe symptoms of fecal urgency, frequency, having to run to the bathroom all the time. They often lose control of either gas or bowel movements, and it's a very frustrating problem to have. Fecal incontinence is a very sensitive issue. People feel, very embarrassed to talk about it, and a lot of people don't even know that there is a solution out there. So I really encourage people to seek help when they do have this problem. A lot of people don't know 1 in every 10 adults, both men and women, and 1 in every 3 women after childbirth will experience fecal incontinence at some point. So it's an important issue. A lot of people have it. A lot of people don't want to talk about it, but there is a solution out there, and I definitely encourage everyone to reach out to their physicians when they have these problems. A lot of primary care physicians don't even know that there's a solution out there. There are simple things that you can do to, kind of help to bulk up the stools and manage the symptoms. But a lot of primary care doctors aren't aware that there's a surgical solution out there. So patients, if they do find out on their own, they can seek treatment from a specialist themselves. The first thing I would tell patients to do when they start having symptoms of fecal incontinence are simple things like dietary modification. So you want to increase fiber intake in your diet, maybe start fiber supplementation. You can use bulking agents such as Imodium to kind of slow down the motility of your stools. Those are simple things that you can do. Pelvic floor exercises, so exercises to strengthen your pelvic floor muscles, that's usually the key to why fecal incontinence is happening. So people often try to do Kegel exercises on their own, and that's a great strategy to start out with. Once that fails, then we move on to more targeted therapy. So we do biofeedback pelvic floor physical therapy. That's when you actually go to a physical therapist's office and work with them to strengthen your pelvic floor muscles. And then third line therapy is when we start talking about surgery. Fecal incontinence, to me, is weakness of your anal sphincter muscles. So a lot of times, sometimes due to age, sometimes due to trauma to your pelvic floor muscles weaken over time. Anything you can do to correct that or strengthen them is going to help treat your fecal incontinence. Specific to Axonics, I really like that the device is small, it's implantable, and it has a really long battery life compared to previous devices that we've used for sacral neuromodulation therapy. I like now that they have both a rechargeable and recharge-free option, so there's flexibility for patients who have trouble remembering to recharge their device, as well as patients who want the smaller device and the longer battery life. The other thing I really like about Axonics sacral nerve stimulator therapy is that the remote control is very easy to use. It's a simple device. It has just 2 buttons on it, and patients find it very easy to both take with them if they need to, as well as to use. I have been using sacral neuromodulation therapy for years, and I at first was a little bit hesitant to change my practice and to try a new company, but I was very pleasantly surprised. More than anything, I noticed that they have superior customer service and accessibility. So my patients had no problems reaching a clinical specialist when they needed help either troubleshooting their device or, more education on how to charge their device. Any issues post-operatively, any questions they had pre-operatively, they had no problems reaching somebody, and that was really important to me. Clinical specialists that are part of the Axonics team that works with me, they have made a world of difference in my practice. I get daily updates from them every day about my patients that are on a trial. I feel very confident at the end of the trial that I know how the trial has gone, and I feel confident moving forward with the implant because of them.